Concerns over Mpox are rising after World Health Organization declared it a global health emergency last week. The agency says a deadlier strain of the disease has been detected in Sweden. Joining me now live in Studio A is Dr. Sheppard, past president of Harris County Medical Society, to help ease concerns with what we need to know about the disease. Good morning, sir. Thank you so much for your time. We appreciate it. Talk to us about whether or not, should we be worried?
You always have to be worried about some health issue that's happening, whether it's here locally or in the world, simply because we are a smaller world now. People traveling all over, so you always have to be worried. Is it as big of a concern compared to, say, COVID or some of the other things? Not at this point. The CDC hasn't issued a series of warnings compared to WHO. WHO looks at world issues, and because there have been some increasing in the number of cases in several African countries and then also in Sweden, as you mentioned, they sort of changed their sort of position. The CDC has not done the same thing for the U.S.
How likely is it for this strain, this deadlier strain, to make it to the U.S.?
It's as likely as any of the others. There's two main strains that they talk about, Clade 1 and Clade 2. And Clade 2 is what happened sort of in 2022. We were seeing more of those. Correct, when you had the outbreak. Clade 1 is the one that we normally see. Clade 2 is the one that's more commonly in endemic areas of Africa. So it's not like it's new. It's been there before. There's some minor changes that it happens, but it pretty much is still what's been in Africa before. So it's possible that these can move because they transmit it not only from human to human, but also from animal to human. And that's sort of one of the things we have to worry about.
What's the status of cases of Mpox here in Houston right now?
Here in Houston, I would think maybe we have 2 or 3 cases. It's very low, and it actually is low across the United States. That's why the CDC hasn't changed their position, because the cases are very low throughout the United States.
For people looking to be proactive, what precautions can they take to minimize the spread of this disease?
One of the big good things that we do is we have a vaccine. It's a 2-shot vaccine taken 4 weeks apart, and that actually significantly decreases your risk for having severe cases. Also decreases your risk of shedding or spreading. So we do have a vaccine already prepared for Mpox now, which is a good thing. But also having to be careful if a person has Mpox, making sure you don't have skin-to-skin contact. They really need to make sure you're not around stuff that they're like sleeping in, things like that, because actually it can be transmitted that way.
Okay, very insightful. Thank you so much for your time this morning.
You're welcome.
We appreciate it.